time for the KBOI Medical Moment. It's brought to you every Tuesday by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence. Dr. Hiatt, good morning.
Good morning, Chris and Paul J.
A couple of years ago, Doc, Chris and I went over to Boise State University, and we went up in the engineering lab, and we saw a 3D printer. Now, this is before you heard much about it. Remember that, Chris?
Yeah.
And what is 3D printing, and how can it be of benefit to the health industry?
Well, Paul J., a lot of people are familiar with 2D printing. That's what we commonly do with our desktop printers. And, of course, they use ink to print two-dimensional pictures on a page. Well, 3D printing can actually print 3D objects in space using not ink, but rather materials ranging from plastic to metal to even human tissue. That's guided by data of the body obtained through imaging studies such as MR, CT, and ultrasound.
And how are those used in healthcare, Doctor?
Yeah, the neat thing about these 3D printers is that they can actually generate these three-dimensional models of complex individual anatomy, and this really assists surgeons as they plan their procedures. And these printers can also create customized dental and medical implants, hearing aids, prosthetics, and even human skin.
So, is it just a matter of time until fake organs are made with 3D printers?
Well, that's the holy grail, to actually be able to create a human liver or a human kidney. And it's thought that maybe within a decade we'll be to that point where we can actually generate in the lab through 3D printing human organs.
Do surgeons find these 3D printed models helpful?
Oh, definitely. It's helpful, to be able to visualize the anatomy before operating on it. So surgeons can actually practice before they operate.
Dr. Hiatt, a study of hormone therapy for women has recently been completed. What did it show?
Well, this new long-term study found that up to 7 years of hormone replacement therapy is safe for postmenopausal women.
And what does safe mean?
Well, what they did is they put these groups of women into this large group of women into two separate subgroups. And they found that those who were randomly assigned to take some form of hormone replacement were no more nor less likely to die of any cause over the duration of the study than women who had been assigned to just receive a placebo. And by any cause, I mean, cardiovascular disease, stroke, cancer, that women taking hormonal replacement therapy are not more likely to die.
So this proves that hormonal therapy may be safe for those who need it?
That's exactly right. There was some concern, Paul J., that women who needed that hormone replacement were reluctant to take it because they worried about the supposed risks of that therapy. Well, this study seems to show that there's no elevated risk.
Doctor, a character's condition on the TV show American Horror Story has been generating some awareness of a rare phobia. Can you tell us about that phobia?
Well, this rare phobia is called trypophobia, and it's an intense, irrational fear of irregular patterns or clusters of small holes or bumps. So this is a fear of a cluster of holes, such as you would see, say, in a honeycomb or a strawberry or a piece of coral.
Why would somebody be afraid of that?
We're not really sure, Paul J. It just seems to be some type of unconscious reflex reaction that some people have that associates an image of holes with something dangerous, such as maybe holes made by insects or holes in wounds or diseased tissue. Or it could just be that people are afraid of what may be lurking in those holes.
Wow.
That's an interesting phobia. Dr. Hiatt, we thank you for your time this morning on KBOI.
Thank you.
Thanks, Doc.
That's Dr. Mark Hiatt, the Executive Medical Director for Regence on the KBOI Medical Moment. It's every Tuesday, brought to you by Regence Blue Shield of Idaho.